All right, that was a mind melter. So we knew that not one person could follow that, right? So we have three. So let me invite the next panel up to the stage. I think this panel follows brilliantly on the both Mr. Goldhill's speech, but also the panel before that around value. This panel is on driving the demand, right? And I think before David, I probably would have said, is it even responsible to drive demand for something that doesn't exist? But now I'm kind of rethinking that. Anyway, so let me go ahead and introduce Susan Reinhard, who's a member of our planning committee, and she's going to moderate this session. She's the senior vice president at AARP, heads its Public Policy Institute, and she's also the chief strategist for the Center to Champion Nursing in America at AARP. And I think go ahead and don't worry about the time runneth over, because we're going to take that away from the wrap-up planning committee members at the end.
So you want us to keep to an hour, right? Yeah. Okay. What's that? Let's get this out of your way. That's a quick turnaround. Thank you, and thank you for staying. And I hope most of us can stay till we really do hear the planning committee members synthesize this. But I know we need to get going. I do have to make one comment about the introduction yesterday. Sherry Kaplan. Is Sherry still here? Oh, it's too bad. I don't know if you remember this, but Sherry had one of her PowerPoints was how she had written for the AARP Public Policy Institute in 1991. Now, I wasn't running the AARP Public Policy Institute in 1991, but I did read a lot of and I actually remember patienthood. That was what she was writing about. And then it occurred to me that's almost 25 years ago, that we ought to get her to do a 25th anniversary paper on that and incorporate a lot of these ideas. So I'll have to follow up after this conference. So I just do want to also mention that I have my AARP hat on, of course. I have lots of different hats, as all of us do, but that AARP does have a pretty big stake in this discussion, and I'm sure that's part of why we've been involved in this. And in all three of the areas that we're going to be talking, I love the title of this. I can't take the credit for drivers for demand. I really do love that title. It's got a lot of power into it. But behavioral economics, this is something that AARP, as the largest consumer membership organization actually in the universe, is very interested in what Kevin is going to be talking about. We keep trying to figure out what we can learn about what drives people to make healthcare decisions in health. I should also say retirement security. What can behavioral economics teach us? Communications and how we can message important information. AARP has like hundreds of people working on communications, always about that messaging. We get lots of information. Consumers get tons of information. So how do you message it and help them sort through all of that information? And then certainly social media and how to use it as a tool for change. So I do feel privileged to moderate this panel, and I'm going to start by going over the session goal. Each of these panelists, we've just been reassured, get their 10 minutes, their full 10 minutes, so that's good. And you get that opportunity to exchange with them as you have after each session. So it's been pretty good, including people outside the room if they're still watching on the web. So you have this description of the session goal in front of you. It's exploring cross-cutting strategies to advance patients, you could say consumer, but patients, of course, in partnership with providers as leaders. We haven't talked about leaders yet. Leaders and drivers of care delivery improvement through informed, shared decision-making and authorized use of clinical data for research and value improvement. So we're going to take this from 3 points of view, as I said. First, with the focus on behavioral economics and value generation. I hope that we talk about that word value and how Shoshana warned us that that term itself isn't necessarily understood by consumers. Kevin, many of you know him, is the founding director of the Center for Health Incentives and Behavioral Economics at the Leonard Davis Institute, which is one of only 2 NIH-funded centers on behavioral economics and health in the United States. He is co-director of the Penn Medicine Center for Innovation, and he is a professor of medicine at the University of Pennsylvania School of Medicine and Healthcare Management at the Wharton School. And I have to add, he is a practicing physician at the Philadelphia VA Medical Center, so that always keeps him grounded. Second, we will consider communicating value to the public, and Treza Undum. We've worked with Teresa at AARP. Many of you have already referred to her. Teresa is a partner at Perry Undum Research and Communication. She leads public opinion research on a whole variety of health-related policy issues, including health reform implementation, delivery system reform, access, affordability, costs, quality. She's perfect for this panel. And then we will turn to a true patient leader. And we're delighted that she's going to be discussing social media as a tool for change. This is Kelly Young. Kelly is the founding president of the Rheumatoid Patient Foundation. So in a very short period of time that hopefully she'll tell a little bit of her story, she went from like 0 to 100 in how she has moved, talk about leadership in this whole area. She is the founder of rawarrior.com, a comprehensive website about RA of about 700 pages, and the hub of one of the most large and vibrant patient communities online. In 2006, she was diagnosed with rheumatoid arthritis after years of periodic symptoms and trying to sort that out. And she works to provide ways for patients to be better informed and have a greater voice in their health care. So it's a really good mix of a panel, as you can see, and we're going to start with Kevin.